All right. Hello, Marteen Santerre here from Soul Being, and today I am speaking with Danielle Kroot. Danielle, welcome.
Hi, thank you for having me.
Danielle is a doctor of physical therapy with Starting Line PT and Performance. And Danielle, I'd love to start by asking you what led you to physical therapy, why that choice as a profession.
Absolutely. So I got into physical therapy. I grew up as a field hockey player, softball player, and I just always liked being active. And growing up, I wanted to be able to help people. And at first I didn't know exactly what that would entail.
Yeah.
But physical therapy kind of was allowing me to cover all those bases.
Okay.
Help people, but also be active alongside my patients.
Wonderful. And so what do you specialize in then in your practice?
So I have a passion for working with runners
Okay.
and triathletes, so anyone in that endurance population.
Okay.
And so I've specialized working with managing running-related injuries, performing running analysis from a preventative standpoint,
Oh,
so
cool.
getting insight to what might be going on with their running. But I also offer return to running programs. So
Okay.
maybe you're a new runner, maybe you're trying to get back to running after an injury. So that this will allow them to, after they're done with physical therapy, transition into more of a performance
Okay.
thing.
So then when you're doing that, is it, I guess what kind of goes along? Is there strength training that goes along with that, along with the physical therapy?
Yeah, so in physical therapy, I'm working to get them back to function, and that will be through some hands-on treatment, some strength training, but then once physical therapy is done, that's when we can take things to the next level and really challenge themselves.
Okay, great. And so you're obviously helping them as they continue and get back on their feet with enhancing performance as well.
Yeah, I like, I'm a run coach and a triathlon coach as well.
Oh.
So being able to...
Two first.
So being able to cover that spectrum
Sure.
of injury to performance and filling in the blanks as needed in between.
Awesome. That's very cool. So you also have another specialty that we were talking about before we started recording this, called dry needling. Tell us what that is.
Yeah.
And what do you do with dry needling?
Absolutely. So dry needling is an additional therapy that uses acupuncture needles, but is in fact different mechanism behind it. Okay. So it's not based on energy or chi. It's more anatomically based, and where I use it the most is dealing with chronic pain. So
Obviously very common.
Very common, and it's something that I see it more on a neurophysiologic level, where it's going in, it's sending a different input to the brain, almost as like a reset button.
Okay.
I like to explain it very simply for patients so that they can understand where I'm coming from. But I see it work best with like chronic fasciitis, TMJ, chronic neck pain, chronic low back pain. And it's not meant to be done in isolation, but I use it in conjunction with exercise, education, and empowering the patient to be active, and that their pain doesn't have to limit them.
Wonderful. A true compliment to all those things. That's great. And how long does a dry needling session take? Like, what is the involved there?
It depends. So there's sessions where you're going in and out of the muscle, which is called the pistoning technique, and that can be done in a couple seconds.
Okay.
Doing typically two to three needles the first session, overall 5 minutes.
Okay.
Or there's what's called in situ, so it stays inside for anywhere between 10 to 30 minutes is what the research shows, and that's going to be for dry needling for the foot, for plantar fasciitis, for the low back. So it depends on the muscle. It depends on the area.
Okay, very cool. And then what's been your biggest learning then? I mean, working triathletes and runners and people with chronic pain. I mean, what's been your biggest learning as a physical therapist?
Yeah. So the biggest thing for me is being able to establish a great rapport with my patients and my athletes. I think it's really important to have good communication and listening. Most recently, I heard a quote that says, your physical therapist should be your best friend in healthcare. And I think that that's so true. Like, we're in your corner. We want to help you reach your goals, but we also want to answer your questions and empower you to be able to do things on your own as well.
Wonderful. Thank you for sharing that with us.
Yeah, absolutely.
So Danielle Kroot, Doctor of Physical Therapy with Starting Line PT and Performance. Thank you. You can get in touch with her at soulbeing.com.
Thanks.
All right.